Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Neighborhood Health Watch, we're talking about deep brain stimulation, or DBS. Now, in case you haven't heard of this, DBS is a surgical procedure that involves implanting electrodes within certain areas of the brain. It's used to treat a number of neurological conditions like Parkinson's disease, and it's usually performed while patients are awake. But now doctors are able to perform the surgery as patients sleep. Dr. Matthew Boyce from Henrico Doctors Hospital joins us now to talk a little bit more about DBS. Now, we've talked a little bit about the implants in the brain. What exactly is going on there?
Okay, so that's a great question. Deep brain stimulation is really a surgical procedure that involves placing an electrode or a wire into the brain to treat the symptoms of Parkinson's disease.
Oh, wow. And what exactly is the electrode doing in the brain?
Well, folks with Parkinson's disease suffer from symptoms like tremor, muscle stiffness, and slowness, but the electrode is able to send a signal to help control those symptoms.
Now, who would be a candidate for DBS?
So someone who's a candidate for DBS is someone who's diagnosed with Parkinson's disease and has traditionally done okay with medication, but now they're finding their medicines are wearing off too quickly, or they're starting to have a lot of side effects from medication.
Okay. Now, what is asleep DBS?
Okay, so traditionally we have a long-standing program at Johnston Willis where we've been performing the procedure, but now we're able to perform the procedure with the patient asleep. And essentially what's involved traditionally is the electrode is placed in a part of the brain. To verify that the electrode's in the right spot, we would normally test the device in the operating room. Now what we're able to do is, which the patient will be awake for that, now what we're able to do is do a picture of the brain with an intraoperative MRI scanner that allows us to verify that the electrode is in the right place.
Are there any benefits to the patient being asleep rather than awake?
Right. The obvious benefit there is in traditional DBS, the procedure is actually done with the patient awake through the entire procedure. So they're in an operating room setting, having a brain surgery done awake. But for some people, that's a difficult idea to palate, and so this is an option for patients to allow them to undergo deep brain stimulation while they're asleep through the whole procedure.
Now, again, this is not a cure. Correct?
Correct. DBS is not a cure for Parkinson's disease, but it is a tool for treating the symptoms of Parkinson's disease.
Okay. Well, thank you so much for joining us,
Thanks
Dr.
for having
Boyce.
me.
And we'll have more of this information on our website, NBC12.com.